every patient with migraine has a unique story. And we think of this as the patient journey. So from the start of their first migraine to when they actually seek care, that's part of the journey. And sometimes it can be very quick. It can be you get the first attack, you go to the emergency room, there'd be 0 time between attack and diagnosis. But sometimes it's a long time. Sometimes it's years, months, years. And sometimes people don't even ever seek care for migraine. For this study, though, we are looking at Sutter Health patients and the care that they receive for migraine. Now, Sutter is a very large integrated healthcare network, and we serve about 3 million patients. And from this, we know we have approximately 100,000 patients who seek care for migraine or have sought care for migraine from us over the past several years. So we have a very large cohort, and we were able to obtain patient-reported outcomes on about 2,000 of these patients. And so what we did with this study is we looked at the electronic health records of the patients as they come into our system, and we combined it with some records from the patients themselves. So we asked them questions. We did a survey of a subset of our patients, and we are able to combine the data sources, thus giving us a very rich source of data that includes both electronic health records from the encounters and some patient-reported outcomes as well. By combining 2 different very unique sources of data, we are able to get a better picture of the whole person. So if we were only using the EHR data, which most healthcare systems now can access their EHR data, we would miss the whole part of the patient story. So we would miss the patient's voice. By looking at only the survey data, then we would have the patient's voice, but we wouldn't have accurate data on comorbidities and other utilization fields, and we probably wouldn't have as accurate data on the medication use. So putting the 2 together really gives us a much better picture of the whole person. So we call it the signature study because we think of the path that each person takes as their journey, and it's unique in the way that a signature would be unique. And so we call this the migraine signature as sort of the description of their journey. And so we feel that there may be some similarities to people's signatures, and so what we want to do is classify the things people have in common and the commonalities between signatures, and hope to categorize and characterize signatures into groups that might help us better care for them. So the first thing we looked at was whether or not they sought care from neurology versus seeking care entirely from primary care. So some patients will receive the totality of their migraine care from a primary care provider. Others will seek care from specialty care. And so what we found was among those patients who sort of looked as though they were coming to us for their first migraine diagnosis, and what that means is that we looked at them, we observed them over a period of time where they had no care for migraine, but they sought care from our system, and followed by a diagnosis of migraine. And about a third of our patients look like that. So we know that they're probably coming to us the first time they get migraine. And about a third of those are actually seeking, get the diagnosis from neurology, and about 2/3 get it from primary care. We're hoping to build a model, a statistical model, that helps us predict whether people receive care from neurology or not. So we want to learn what causes a person to go and seek care from neurology. And so when you put things in a model, you can have small differences, but that might still help determine whether they seek the care. And so what we want to do is we want to build a model and understand all the different factors that go in. So by itself, it might be a very small contributor, but if you start to drill down and maybe look at non-Hispanic Asian men who are 50 years old, that might be a much bigger difference. And so we want to look at these subgroups and better, we're hoping that by looking at subgroups, we can better define the care that the patients need to receive and help to give them better migraine care.